Good afternoon. This is Dr. Sudhina here from MyDentalPlan. So in this webinar, I'll be guiding you on how to access our web portal and mobile app and how to upload the treatment plans. So we'll start from now. I'll be sharing the screen to you. So we log into our web portal is mydentalplan.in. So this is our web page. So once you log in, this is the page that opens up. So on the right upper corner, we have a dentist section. You can click on that. So once you click on that, there's a login ID and password, which the portal is asking. So each of you providers will have a unique ID, which you can log into, and password has already been shared to you. In case you don't have those links, you can always contact our customer support team, which will be sharing the same with you. So since I'll be demonstrating, I'll be using a demo ID to you to log in, to display, or to show how this functions. So once I've entered the username, I'm going to enter the password. So I'm going to log in. So once this opens up, if the provider has multiple clinics, you will see the screen pop up to select between the two clinics. I'm going to select the first clinic here. Okay. So once this is done, so this members card here and various cards, there are 3 cards displaying here. This members is the total number of patients that you would have received from MyDentalPlan. And this is the total treatments. It's a number of treatments that have been completed from MyDentalPlan patients. On the left-hand side, you have various menu card options here, which I'll be guiding through you later on. So once you just scroll down the screen, we have an appointments calendar here, and each of the date is marked with a quick view access to the patients that you have on that particular date. So each patients that are displayed here is just a quick view access for you. You want to select a particular case, you can always click on that, and that particular patient details are visible on the right side of the screen here. So now I'll be demonstrating to you how to access our web portal and upload the treatment plan. So I have already created a patient which has come through the appointment. I'll be logging in here. So once I click on the quick view access, the patient details are visible here along with the phone number and the company through which the patient is coming from. Okay. So once this is done, once the how it usually functions is a customer support team will have contacted you, and once you have confirmed, this is how the screen will appear. Once you log into this, you'll have to click to confirm the appointment. So you'll just have to wait for a few seconds. So the appointment status is confirmed here. So once this is confirmed, once the patient has visited your clinic, you need to click on show. In case the patient has missed the appointment, you can always click on no show. So now I need to upload the treatment plan, obviously, so the patient has come to our clinic. So I'm going to click on show. So again, it is going to ask for a reconfirmation from your side whether you want to change the appointment status to show. So since the patient has already visited your clinic, you can always click on change it, and yes, the patient has appeared to your clinic. You just need to wait. So it has already been updated. You just need to click back here. So the patient has already visited the clinic. So there is no option of no show here. So now we need to upload the treatment plan. There are various cards here again to reschedule the appointment or to cancel the appointments and to add notes. So now we go to link treatment plan. You need to click on link treatment plan to upload the treatment plan here. So now we need to create a new treatment plan for this. So we need to click on create new treatment. So once again, since if there are multiple doctors in your clinic, you can always choose to the attending doctor who is going to do the procedure. I'm going to choose Dr. Pooja here. So once that is done, on the left hand side, you have the patient's name, the email ID, the mobile number of the patient, and the company through which the member is coming from. Again, here, chief complaint in the treatment details, the chief complaint will be in patient's own words. In treatment number, there is a unique treatment number which will be unique to that particular patient. So again, this is a unique appointment ID, and the date the appointment was already there. Okay, so we just scroll down the screen. So there is various options here. In the provider note section, you need to enter your diagnosis. So in this, I'm going to, since I've already seen the clinic, I'm uploading the treatment plan. So since I know what the diagnosis is, I'm going to enter that here. So I'm going to enter irreversible pulpitis with the particular tooth. Also, patient needs scaling. So I'm going to add that also as chronic generalized gingivitis. Okay, so we will update this. So once this is updated, so you just scroll down the screen. Under the add dental procedure section, there is a dental procedure here and a search bar, which is always prompting you. So this is to guide you initially. So now since I've already chosen to add irreversible pulpitis with 2.6. So below the search bar, you have the various quadrants and the corresponding tooth of each quadrant. You can just try it out and click on various quadrants. So you can see the corresponding tooth numbers also displaying for the same quadrant. So this is quadrant 3 and quadrant 4. You can always check the tooth numbers are changing. So now we'll go to quadrant 2 and I'm going to choose the tooth number here and I need to take an IOPA. So I can just type in IOPA in the search bar. So the moment you type in 3 characters, there is a prompt section of popping up and you can choose the appropriate section that you need for that particular patient. Since I need an IOPA, I'm going to choose this option. So once you've chosen this, you need to add that particular procedure. I'm going to add it here. So the moment it is done, you will have a pop-up in the green section here where the procedure is added successfully. And you can always see that this, whatever you chose to add, it is in the procedure detail section where it is already added. Now we'll go and choose, since it is cerebral pulpitis and I choose to do a root canal, you can always type in 3 characters or more. So the moment you type in 3 characters, you have a different prompt here of various root canal options. You have a root canal anterior with the retreatment for the same anterior, bicuspid. So you can just scroll down. So you have various options. So you can just choose the appropriate one. I'm going to choose a root canal molar for this particular tooth. And I need to again click on add here. Remember, it is very essential to add the individual procedure. So again, you have a highlighted section in the green here where the procedure is added successfully. And we have the procedure has been added here. One more thing, what I would like to mention here is, once you add, the procedure cost for each of the treatment is already prefixed and that is displayed in the procedure cost section. So then you have the insurer amount section, which the insurance will be paying. So all those details will be displayed here. So now I'll be coming back to the procedure details. I need to do a core buildup for the same tooth. Once the root canal is completed, I need to add that. So since I've typed core, so we have various options here, including in case you choose to do a post, you can always select the post, whether it's a fiber post or a metal post. So I'll be choosing just a core buildup. There's no fiber post for this or metal post. I'm just doing a core buildup. I'm adding the same accordingly here. So like I've previously highlighted, you have the procedure added successfully in the green color displayed on the upper right section here. And you can always verify whether it is displayed on your procedure details. Now I choose to do a crown for this particular tooth. So once I type crown, so similarly, you just type in 3 or 4 characters. There is a various pop-up sections that is prompting for you to make your work easier. So you can choose the appropriate crown that you choose to do along with the discussion that you've had with the patient and what he is choosing. And in this particular case, I will just choose to do a lava classic crown for this patient. So again, you need to add, again, it is added successfully. Again, you can just verify here. So now going to the next section, I'll unclick the highlighted portions in the quadrant and the tooth number. Since the patient requires scaling, I need to choose scaling. Once I have typed in similar, just type in 3 or 4 characters. There is various options that are prompting you to make your job easier. So now accordingly, I need to choose what kind of scaling I need this particular patient requires, whether there are too much of subgingival calculus and stains or all that. In this particular patient, I just choose a simple cleaning here. I need to add that. So there is no other treatment that is required for this particular patient. So accordingly, all the treatment plan that I chose for this patient is completed. So I will just cross verify here whether whatever I had planned for this particular patient is completed. Everything is displayed in this procedure details. So since I was explaining to you the uh, various sections that are here in the procedure detail section, this is the code and the procedure here, the tooth number and quadrant that are selected here. Then we have the procedure cost. This is prefixed by the insurance company. Then individually, whether this procedure, once this is authorized, then all these sections will come in where the procedure discount is there. Then you have a copay discount. And this approved amount is the most important one, which the insurance company will authorize for each individual patient. So based on this only, then only we can proceed. And this will be highlighting to you the amount that has been authorized for the procedures. So now this will be what the company is paying, whether there's if the doctor is willing to give any additional discount, and the total amount paid, or in case the patient is paying any amount. So once you can just verify all this, once this is done, you can just send this for authorization. You need to click on this blue highlighted button here. So once you click this, it will ask you for a reconfirmation whether you need to add any other procedures or do you need to send it for authorization. I have finished my treatment plan for this particular patient, so I'm going to click on confirm. Wait for a few seconds. So once this procedure is sent for authorization, again, you will have a display screen that changes, and you just above the provider notes, you can see that the treatment status is sent for authorization. So once you complete this procedure, the same details, so the treatment plan that you've entered is automatically sent to your insurance provider of the patient for approval. So once we get an approval, then we will again progress to the next section. So once the approval has come from the insurance company, this is how the screen will reflect to you. So now you can see the status, treatment status that was sent for authorization has become authorized. Then you have the total authorized pay, the total treatment cost, and how much the patient has to pay. The total cost is here. I'll just scroll down the screen for you. So now we have this. The IOPA is completely authorized. You can just click on complete. So the entire amount has been approved. So for the root canal, the cost of the procedure was 5,184 and the approved amount is 5,000. The patient has to pay a balance of 184. So this is the most crucial part where you have to, once the procedure is done, each of the procedures you'll have to click on complete for us to raise the invoice for the corresponding treatment. So now I will click on complete for this. Are you sure you want to complete? Yes, I have completed the X-ray. Yes, I'm going to click on yes. Okay, so then the invoice is, so the status is completed. Now I go back to the root canal here. So out of 5,184, the approved amount is 5,000. The patient has to pay 184. So this is at the doctor's discretion whether the doctor wants to give a discount of 184, which can be here procedure discount, or whether the doctor wants to collect this. So out of 184, I'll just give you a brief this thing of how to go about it in case you want to give a discount. I'm going to click on discount. So out of 184 rupees, I'm going to give a discount of 34 rupees. Okay. So now I'm going to give a discount of 34 rupees and I'm going to click on save discount. So it's going to ask you for a reconfirmation whether you want to add a discount to this procedure. I'm going to click on yes. So now we can see all the values change here. So you've given it out of the total cost of 5,184 rupees. Upper amount is 5,000. You've given a discount of 34 rupees. Patient needs to pay 150 rupees. So for us to know that you've completed this procedure, what you need to do is you need to click on payment again, and in this section you have to collect the amount in cash. I'm going to type 150 rupees. I'm going to click on cash pay. So our patient has paid 150 rupees to me by cash. 34 rupees is I've given the discount. So it is reflecting here where you collected the cash. Now coming to the remaining things, all of you must remember, you can always go back and refer to the video, what I've just shown to you. And coming to the next following procedures, the core buildup is 1,920, the crown is 13,440, and scaling is 1,600. None of these procedures is authorized. There is no discount, but the patient needs to pay to get this treatment done. So accordingly, you will have to inform the patient and make sure you collect this amount and inform us. So as I've just shown to you, you have to click on the payment section, enter the amount here, and just click on cash pay. Do not click on online pay or cashless pay. Click always on cash pay and mention the amount here. The moment this is mentioned and you click on cash pay, it automatically means that the procedure is completed and you have collected the amount, and the same will be deducted in the amount that will be paid to you. So always be careful in this payment section. I'm just repeating, please be careful in the payment section and be very thorough in what you're entering and what you're not entering. So in this procedure, for right now, the patient chose to get only the root canal treatment done and the X-ray, which has been completed. Right now, he is not willing to progress for this. So the bill will be raised for this, and your reimbursement will happen within 45 working days. So this is all regarding our uploading the treatment plan and individual completion of the procedures